My name is Josh. I'm the Youth Coordinator for the North of England team here at Diabetes UK, linked in with Together Type 1, and today's talk is Together Type 1's Toolkit, Eyes on Diabetes. So, as I've mentioned, my name is Josh, and I've got my fellow co-host at the top right here. I'll let her introduce herself.
Hi everyone, I'm Rosie. I'm the youth coordinator for the South East Coast in London, and like Josh, I work on Together Type 1. Nice to have you all here.
So we'll be starting very shortly, but what we would like to do is just give you a few little ground rules, if that's okay, just because this talk is attended by quite a few of you, but we want you to be able to interact as much as you can. So as you can see, we've got a talk for the next hour, which is on Together Type 1 and our eyes on diabetes. That is why you're all here and interested. But we also have things in the background where if you would like to ask any questions or if you would like to have any little talks, please do send a message in the chat. So we're more than happy to, at the very end of this evening, to talk about our all these questions. So again, if you have any that pop up all through the talks, please feel free to pass them over. Also, feel free, as you can see on number 1, to take some breaks. This will be getting recorded, so you'll be able to watch it in the future, because I know you're going to be also interested to know what's going on. And then when it comes to our little chats, if you feel like you need to have a step back or have a break, please do. It's totally up to you. As we mentioned before, this is getting pre-recorded anyway, so feel free to make sure you have your little step back, have a breather. As some of these conversations that will be spoken about this evening are lived experiences from our fellow young leaders on this call. So you'll be able to hear some things that you might be experiencing yourselves. So please do feel free to have a little step back. Have I ticked everything off there? Making sure, Rosie?
Yep, I think so.
Okay, brilliant. So I'm going to introduce you to our first young leader. His name is Gareth.
Thank you, Josh. Welcome, everyone. Hopefully you have an interesting evening. I'd like to introduce our first healthcare professional tonight. Her name is Charlotte, and she's going to be talking about what goes on in an appointment. Charlotte, over to you.
Hi everyone, my name is Charlotte. I work for diabetic eye screening in the south of England, and I'm one of the people who looks at the photographs that are taken during retinal screening. I'm going to do my best to answer your questions today that you've put forward to us. So why do we look at your eyes? Well, we're looking at your eyes to see if you have any diabetic retinopathy. And there are lots of factors which can cause you to have retinopathy. But a lot of the time, if you've had diabetes for any length of time, you will start to see these small little changes. But that doesn't necessarily mean that they're going to go on to be anything sight-threatening in future. The changes we see can also come and go over the years. That's not unusual. So the reason we screen you is we can pick up changes in your blood vessels at the back of your eye long before you notice any change in your vision. So in a sense, we are the early warning system. And what we can do is if we notice any of these changes, we can do some extra monitoring of you, and that might be using photography, or it might be using new equipment called an OCT, which is optical coherence tomography. Now, Sam is going to talk to you a little bit later about that, so I'm not going to cover that too much now, but you may have one of those. Or we can refer you to the eye hospital if we think you might benefit from treatment. And the reason we do all of this is because the earlier we treat you before you've noticed any change in your vision, it's about preserving that good vision that you have. So one of the questions we got asked was, what do my result letters mean? And we absolutely appreciate that it's very scary getting a letter in the post when you don't understand exactly what some of the words mean. But what I would say and really sort of stress to you is please do contact your programme if you are, you're unhappy, you're worried. We don't want you sat there worrying about your letter. Please call us. We're very happy to talk to you. I have lots of patients that I speak to, some of them quite regularly, and just having that little chat and somebody explaining it to you can make all the difference, and then it doesn't seem quite so scary. So new letters have been drafted based on feedback given, and there is also some changes to the screening intervals, which means some people are going to be screened at different times. So, you know, you might be chatting to one of your other friends who said, oh no, I'm going every 2 years. And when you think, well, I'm going every year, what's the difference? I'll explain that shortly. And as I said, some programs will be providing OCT for patients who have maculopathy, and I'm going to explain that a bit more in a minute as well. So you may get a letter which says you have no diabetic retinopathy. So that means your eye looks nice and healthy. There are no changes to it. I'm going to quickly tell you a little bit about your eye. So this bit here that I'm circling, this is your optic disc. And this is where the nerves go into your brain to form the picture that you see. The bit in the middle, this is your macula, and this is where lots of the hard work is done in your eye. Your fine focus reading vision all happens here. And the little bit right in the centre, that little bit there is your fovea, and that's almost like a little dip in the centre of your retina. And that's going to be important when Sam talks about maculopathy shortly. So you will either get a letter which says this, that you will be seen in 1 year. So for people who have background retinopathy or stage 1 retinopathy, they will be seen every year. Or if you've had a negative result previously, but you've only had one negative result, you know, maybe this is just going to be your second screening you're going for, then you will be seen in a year as well. If you get the letter here, which says you will be seen in 2 years, this is because you have had 2 negative tests in a row. And having 2 negative tests in a row, research has shown, is you're very safe to be seen every 2 years. It's background retinopathy, or also now called in the result letter stage 1 diabetic retinopathy. So it means there are some small blood vessel changes, but there's nothing there that requires any treatment, nothing, you know, you need to be referred to the hospital for, be seen more often for. You will just be seen in 12 months' time. So I appreciate this is probably a little bit small to see, so I've zoomed it up a little bit. So what we start to see, these little hemorrhages can start to appear, and this is where the vessels have just become a little bit leaky. There's another example there. So you can get these little, I call them dots and spots, but they're technically called microaneurysms and hemorrhages. You can also see various other types of pathology as well in background retinopathy, but nothing, as I stress, nothing that requires any treatment, and your follow-up will be in 12 months. So the next level up, if you like, is if you have stage 2 diabetic retinopathy. And we also call this pre-proliferative retinopathy. And this means there are slightly more changes going on at the back of your eye that we do need to monitor a bit more carefully. And we will see you more often, or we may refer you to the hospital eye service. And there are now 2 categories of stage 2. So there is a low risk and a high risk, and the low risk are the ones that we see in the diabetic eye screening programs. The high risks are referred to the hospital eye clinic. And what you will see is a bit more activity. So you can see this picture has got a few more dots and spots on it. They look a bit deeper, a bit redder. And the other thing we can start to see is that the vessels themselves, so these are the veins here, they're starting to go a bit lumpy and bumpy, a bit sausagey. Now this indicates to us that the blood supply is not as good as it should be at the back of the eye. And here's a close-up of some of those deeper, darker hemorrhages. So this is when we become a little bit more concerned and want to monitor you a bit more closely. It's worth noting that if you have the stage 1 retinopathy, the background retinopathy, that can get better, that you can go from having stage 1 back to not having anything. And again, it's possible when you're in stage 2 to go back to stage 1. So it's a very changeable thing depending on how your diabetes is doing. Okay, so I'm going to move forward now. So this is probably what everyone would term the more scary letter. So this shows that you have stage 3 diabetic retinopathy, which is proliferative retinopathy. So what happens is because the blood supply to your eye is not as good as it should be, your eye is very clever and it thinks, oh, I need some more oxygen because it's not getting enough oxygen through the blood supply. It becomes what we call ischemic. So the eye thinks, well, I'm going to grow some new blood vessels to try and get some more oxygen in. The problem with these new vessels when they grow is they can be very unstable and they can bleed where they break. So that's what we can see in this picture here. So this eye has had some new vessels growing on the optic disc and it has caused quite a significant bleed. This is a sort of a nasty looking one, but for the purposes of this talk I wanted you to be able to see it on your laptop screen or whatever it is you're watching this on. So there you can see these are the new vessels that are growing on the optic disc and they've broken down and they're causing a bit of a bleed here. So this is when we will refer you urgently to the hospital eye service. They should see you within 6 weeks, and Sam is going to talk a bit more shortly about what kind of treatment they would do for this. Okay. The other thing you may get on a letter is you may have signs of diabetic maculopathy. So this means there are changes in the centre of your eye in the macular area, and as I said earlier, this bit here is where all your fine focus and reading vision is, and there's also that little dip at the centre as well. So as you can imagine, if you have a damage to the small blood vessels and they've become leaky, if you get any of that fluid in the centre part of the eye, that's when it can affect your sight. So that's when you may start to notice changes, although this person may not have noticed any changes yet. So that's a bit of a close-up. So this is the bit in the area, this is the fovea, and these yellowy bits here, these are called hard exudates, and they're an indication that there's been a bleed, there's been some fluid there. And so this patient might have some laser or they may have some injections, but Sam is going to talk to you a little bit more about that in detail on the next talk. So that's a very brief overview of what we look for and what the letters mean, and we'll be very happy to take any questions after the session. Thank you.
Thank you, Charlotte. As you're all aware, as we've said before already, this talk is going to be covering quite a lot of topics that we're all interested in. That's why we're here. And some of the things that you'll hear, again, as we've mentioned before, might be a little bit personal, or you might start to feel a little bit anxious about. Please, if you need to take some time, do step away. That's what we're here for. This is getting recorded, as already mentioned. But also, if you have the questions, please do look on your little chat box where it says to everyone. Put your questions in if you want to speak openly, or direct it to either myself or Rosie, and we can speak out that question for you. I also wanted to say there's going to be a poll popping up in a couple of moments' time. Feel free to click it. We're just trying to gather a bit of information, and we'll be able to see how this conversation goes this evening. Oh, mine just popped up there. So I'm gonna click it, and then I'm gonna do this, and that'll be sent. So if you've had your chance to have a little click, please be ready for our next speaker. This young lady is coming all the way from the southeast. Please welcome our friend Freya.
Hi everyone, thank you Josh. We are now going to move on to the next speaker, Samantha Mann, and she's going to be talking about referral to the hospital for retinopathy.
Hello, my name's Samantha Mann. I'm a consultant ophthalmologist at St Thomas's Hospital and the eye screening lead for South East London. I'm going to be talking to you today about referral to the hospital for your retinopathy, how you can reduce your risk of progression, and what the treatments involve. Why would you be referred to the hospital? This usually means that your retinopathy or maculopathy has progressed. Remember that stages 1 and early stage 2 can be reversible with good diabetic control, and it can take years to progress through the stages. But remember, not everyone progresses to stage 2 or stage 3. There are 3 main reasons why you may be referred to the hospital. 1, if you progress to the higher level of stage 2, or what we call the pre-proliferative stage. This usually means that you just need more frequent review, usually in a hospital clinic, because you have more sophisticated equipment there. Or if you develop stage 3 or the proliferative retinopathy, this is where extra blood vessels have started to grow on the back of your retina, and you may need to be referred for potential treatment. Or 3, if you've got maculopathy that started to cause swelling on the retina that can be detected on an OCT scan. What happens when you get to the eye clinic at the hospital? This is similar to screening, where you have your vision checked first of all, then you have drops put in, and then you'll have what's called an OCT scan to look for any maculopathy or swelling on the retina. Here you can see a quite normal looking OCT scan. Then you'll have wide field photography, and this is to look at the retinopathy in more detail. And then lastly, you'll have an examination and then a discussion with your doctor to have a plan for your eye treatment or eye management. What can you do to reduce your risk of retinopathy progression? Well, there's things you can't do much about, and that's the type of diabetes you have or duration of diabetes. If you've had diabetes for about 30 years and you have type 1, you're almost 100% likely to have some degree of retinopathy, not necessarily requiring any treatment. Also, ethnicity is important. If you are of African, Caribbean or Asian background, you're likely to have a higher risk of having macular changes or retinopathy requiring treatment. We don't fully understand the reasons for this. There are also things that can be changed. So your sugar control is key. That'll really help to stabilize your retinopathy and reduce your progression. Blood pressure is also important if it's maintained below 140/90. And lipid control as well. There is some evidence that the newer phenofibrate medications, which can be used to bring down lipids, can be helpful to reduce the risk of progression. Pregnancy is also very important. It's really important that you inform your healthcare team and the screening team if you are pregnant, as you will need to have checks more frequently for your eyes, as the retinopathy can progress faster. Non-attendance is really important as well. We know those that don't attend for 2 years in a row have a much higher risk of needing to be referred to the hospital when they attend. So what happens if I'm on an insulin pump? There is a bit of a double-edged sword here. We know that if sugar levels come down quickly, there's a very small risk that the retinopathy can worsen slightly. If you are on a pump and you currently have no retinopathy, you might be asked to continue to attend the eye screening every year rather than every 2 years, at least for the first 18 months or so. If you have some retinopathy already, then you might be asked to attend the eye clinic more frequently over the first 12 months, and that's in order to have more checks. And it may be that we have to bring your HbA1c down much more slowly, especially if it's very high. In the long term, however, you'll do much better having more controlled sugar levels. So when do I need treatment? Only a very small proportion of those with retinopathy or maculopathy will go on to need treatment. Most of people just need increased monitoring. But many people ask, surely I'll have symptoms if I need treatment? Well, no, that's not usually the case. You can actually have quite advanced changes at the back of the eye and actually have no symptoms. Ideally, we need to catch the retinopathy and maculopathy early before any symptoms occur. Most treatments can actually help to prevent visual loss or help to restore vision if it's already affected. This first diagram shows you stage 2 retinopathy. In these cases, we only really need to observe the eyes and improve sugar control. If you get to what we call stage 3 or proliferative retinopathy, where extra blood vessels have started to grow on the back of the eye, this is when we would normally recommend a course of peripheral or pan-retinal laser treatment. We'll talk more about that shortly. Or you may have developed advanced maculopathy. This is when the OCT scan that we showed you earlier shows an area of swelling on the macular region. The middle picture shows you some swelling just off centre, and then the picture on the right shows you a cross-sectional view where it started to get swelling into the centre part of the macula. These will require either treatments with focal laser treatment or injection treatment, depending on how close the swelling is to the central fovea. So when do I need laser treatment? There's two different types of laser treatment. One is what we call the focal laser treatment, or what we call the pan-retinal laser treatment. So if you have non-center involving macular swelling here, as shown on the left, you'll need what's called focal laser treatment. And if you have stage 3 or proliferative diabetic retinopathy with new blood vessels growing on the retina, that's when you'll need the pan-retinal laser treatment. Treatments usually take between 5 and 20 minutes, depending on the type of laser. If you need the peripheral or pan-retinal laser, this can cause a twinging sensation during the treatment and can cause a headache for a couple of days, but it's usually very well tolerated. Your nighttime or your peripheral vision can sometimes be reduced, but the laser can reduce your risk of sight loss by 90%. The laser can't actually improve your vision, but it can help to preserve your vision in the long term and reduces the risk of progression and bleeding into the eye. This QR code will show you a video that we made in our hospital about some patients' experience with laser treatment. Please scan it if you want to see the video. So what about surgery? When is that required? Very rarely, if the pan-retinal laser treatment isn't enough to stop the retinopathy progressing, bleeding can then occur into the gel of the eye, and we often call this a vitreous hemorrhage. This can lead to reduction in vision and floaters appearing in your vision. In very advanced cases, the retina can be pulled away due to the extra blood vessels and scarring in the back of the eye, and this can lead to a retinal detachment. In these cases, vitrectomy surgery can help to restore the vision, and this can be done under a general anaesthetic if needed. So when do you need injection treatments? This is when the central macula has caused to become swollen, and this is often associated with visual blurring. You can see OCT scan here where the central retina is now thickened and swollen, and you can see on the map view in the top left-hand corner where there's a red and white area where the swelling has now involved the central macula or fovea. We normally recommend a course of injection treatment with either an anti-VEGF agent such as faricimab or aflibercept, or a steroid injection. And although these sound really scary, they're not actually that painful. We usually numb the eye first, and there's usually a pressure sensation during the injection, and then afterwards a gritty sensation for about a day. Usually people are back to normal by the next day. We need to give you a course of treatment for the maculopathy, usually once a month initially for at least 4 to 6 months, and then less often. And the treatment usually starts to take effect within a few weeks or months. The OCT scan here at the top shows you some central swelling, and after a course of treatment you can see almost normalization of the OCT scan where the contour and the dipping in the center has been restored back to normal. And this is the only treatment that can actually improve vision and get rid of the swelling on the central macular area. So in summary, remember, just about everyone who has diabetes for 30 years will have some level of retinopathy. The stages 1 and early stage 2 are reversible with good diabetic control. Attending screening helps to detect these changes early before symptoms occur. If you do get referred to the hospital, don't be too frightened. Most people just need closer monitoring with OCT scans and photos rather than actual treatment. Try to control your sugar levels as best you can and go to your appointments. This will give you the best chance to preserve your vision. If you do need laser or injection treatment, or very rarely if you need surgery, this is often to preserve and protect your vision to prevent sight loss, or help you to restore your vision if it's already been affected. Don't be afraid to discuss your concerns you have with an ophthalmologist. They'll usually be happy to answer any questions you have. Please do feel free to email me if you do have any other questions for me. I'm sorry I can't be with you today to answer your questions in person. Thank you very much for listening.
Thank you to our speakers, Charlotte and Samantha, for those really informative videos. I'm Megan, and I'm a Together Type 1 young leader from Leeds. I'm going to be sharing my experience about my recent diabetic eye check. So ever since my diagnosis, I've had a diabetic eye check every single year. As someone who's worn glasses since a child, it's been quite a priority for me to get my eyes checked and to make sure that everything is fine. And since moving away from home, I've been attending my appointments alone. So I know it can feel quite daunting having to go to your appointments, but I'm hoping that by sharing my experience, it will encourage others to go and get their eyes checked. So I recently had my eye test in February, so last month. This was 1 year after my last appointment. I was happy with the location and time that was sent to me by the letter, so I didn't have to do anything that far in advance. However, 2 weeks before my appointment, I received a text just asking me to confirm that I was happy with it. And then I also received a text reminder a few days before, just checking that everything was okay. So this is the first time that I'd visited this health centre. Luckily, the receptionist was really friendly. She answered any of my concerns and pointed me to the correct waiting area. So the doctor who came out to then see me was also really friendly and lovely. She asked me a few questions that were, had I had any surgery on my eyes before? Had I had any problems with my eyes recently? And have I ever had a reaction to the eye drops when I've had my previous checkups? So because this was all fine and I hadn't had any problems, she then explained about the eye drops, put them in my eyes, and then gave me a small leaflet that explained what the eye drops were and what to do if there was any concerns, and then the response that I might have. So in this case, my eyesight was quite blurry for about an hour, but if it was to go on longer than that, then there was an email that I could just email and get my questions answered. So then I had to wait 15 minutes in the waiting area before she called me through again. And then this time she explained what the photos were that she was going to be taken. So it's quite similar to what Samantha explained in her video. She was explaining that the process would be to take photos of the back of my eye as well as the front of my eye. And I found this really useful to be explained to me whilst I was there. I think in the past I've had it where I've just gone in, had the eye drops in, had my photos taken, and that was it, and then received a letter afterwards. But it was really nice that she went through it and explained it to me. And I felt like that if I had any questions, that she'd be more than willing to answer them. So after the test, she explained the next steps, which would be that the photos would be sent off to be examined, and then I'd receive a letter in the post that indicated the results and if there was any concerns. Luckily, there was no signs of diabetic retinopathy. So my next appointment would be in 2 years' time. I also got sent a link on my NHS app, which showed the photos of my eyes, which was really nice. I've never had this before, so it's quite cool to see the photos that were taken. But overall, this was a really positive experience. I think it's definitely calmed my nerves for the future in going. And it's quite nice to have that backup that I don't have to go for another 2 years. So I'm hoping that just by explaining my experience and that it was quite a positive one, they will help to encourage you to also go get your eyes checked. But I'm now going to pass on to Freya, who will also share some things about her experience.
Thank you, Megan. My experience is mine aren't going to be as much detail as Megan, partly because I can't remember. But I had mine done about a year ago. Which then they informed me that I wouldn't need mine doing for another 2 years. But since I've been diagnosed, I've still had them every single year. So that's when it kind of took me by surprise when they said that I didn't need to have it for 2 years. I didn't really know much about retinopathy until today. I just kind of saw it as something that I needed to get done, and it was just like one of those things, you know, like you get your bloods done every year, you get your urine test done every year. I kind of saw it as that. This has definitely opened my eyes massively to more of like the seriousness of it. And I just remember over the years it had definitely changed locations, but I think last year so much has happened I can barely remember, so I do apologize. I went to this room and I've never had to have the eye drops, so I can't give my experiences with the eye drops because with my eyes I've never had to I haven't had to have them, so I don't know about my experiences with them. But went into this room, she like checked my eyesight a little bit and then took photos at the back of my eyes. it would take the lady, I'm pretty sure it was last time, a couple of good goes to because I'm terrible with the flash. I always blink. I've done that in photos since I was younger. It's just one of those things so it does take her a couple of good goes. So yeah, and then I kind of just received the letter 6 weeks later about my telling me to come back in 2 years. Yeah, I don't see it as something to now be worried about, because listening to Charlotte talking about it and Samantha, it's a lot more reassuring to have the appointment and go, rather than to not go and then find out years down the line that I've got something wrong when it could have been easily prevented. So same as Megan, go and get your eyes done. There's nothing to worry about whether you have the eye drops or not. It's just taking photos at the back of your eyes, and it will definitely make a lot of things easier in the long run. So that's my experience, and I'm going to pass on to Gareth.
Thank you, Freya. I'm going to sing praises for each of my clinics that I've had with my eyes, because each time I've been lucky enough to be offered a cup of tea or some kind of refreshment, because they know how anxious I can get. They always talk about what they're going to do, how they're going to do it. The staff are just amazing. They take their time, they don't rush. And what I like with my clinic, they'll show me the photos while I'm there. They'll explain it all, or if I've got any questions, they take the time to answer. It just delivers personal centered care instead of you having to wait and find out if you've got any problems. But they've always been so grateful and helpful for me and my mum when she went with me. But that's the joys of being diabetic for 15 years. So I had to go with my mum to start with. But now I'm in adult clinic, I do it on my own. Still offer me the same services as they did when I was in paediatric care. So it's just always been a good experience on that side instead of others. But I think that's all I can offer, really. Anyone has any questions, please again drop them in the comment section, and we will get to them in our question and answer session. I'm not sure who I'm handing over to. It could be Josh, could be Rosie. I'm not sure.
Thanks, Gareth. That was perfect. Don't worry. Straight back to Rosie and myself. So again, I just wanted to congratulate all the young leaders. Thank you for sharing your experiences, because they are experiences that a lot of our young people on this call and family members will have all had as well. So I just wanted to say thank you. Every one of you were absolutely brilliant. And this is the part of the section where we're going to be introducing our speakers, is it not, Rosie, for our little Q&A at the end.
Yeah, so yep, I'm Rosie. And yeah, I think we're doing a Q&A now, aren't we, Josh? Yep, perfect. So one of the questions in the chat was wondering if cataracts is going to be discussed at all. They said their daughter's been diagnosed with cataracts due to her type 1. Charlotte, I don't know if you want to take this one.
Yeah, I can say a little bit about that. So within diabetic eye screening, we don't deal with cataracts specifically. There's something we do find. And if you have cataracts which obscure the pictures that we take, we can do a different type of test called a slit lamp exam. That's a different way of looking at the back of the eye. So cataracts are dealt with by the opticians. So you need to make sure, as well as going for your diabetic eye screening, you have a regular sight test at the opticians. And if there's a cataract that, warrants a referral to the hospital eye service, they will do that for you.
Perfect, thank you. Young leaders, do you just want to pop your cameras on in case we get any questions for you? I've actually got one myself for you, young leaders. So, as a young person, what kind of would be your advice to other young people who are going to have their own appointments? What would your advice be?
I think just in general, it's so important to do. Well, similar to, I guess, Freya and Gareth, we've been going probably every year since diagnosis. Luckily for me, nothing's ever been picked up, but I like having the knowledge that if something was, then I know the next steps and I know that I'd be cared for as well. So yeah, I think that's quite important for me, just, yeah, the importance of it all.
Anyone else got any advice, Gareth?
I would just like to say, if you don't understand something they're saying at the clinic, don't be afraid to ask, because they're always willing to take the time to answer any questions. Like with me, I've been diabetic for 15 years. So the majority of that was in my childhood. So I didn't understand. And I was always resistant to ask questions. But now I'm always wanting to know, well, what does this mean? What does that mean? It just helps me get a better understanding of what's going on with my eyes and what I can do to keep them the way they are. So I know for the future, if with bad control of my diabetes, that this can happen, that can happen.
Perfect, thank you, Gareth.
Could I also just reiterate what I said in my talk, which is that, as you know, people who work in the screening programs, as screeners, we're always really, really happy to talk to you if you have any questions. Sometimes the people that you see during the appointment might not be the people who are qualified to grade the images, so they might not always be able to tell you very much, because the pictures have to go through, within England, go through a quality assurance system before you get that letter result. But once you've got your letter, please do give us a ring. Like I said, I've got, a few people I talk to every time they go for their screening. I get a little note saying, can you ring this person? And I'm really happy to talk to them. We like talking to you. So, we'll give us a call.
I've got an open question for everyone on this call. First one, probably more about the clinical side for yourself, Charlotte, if you don't mind. And then for all our young leaders, this is a good one. How should we prepare for our tests and what we do on the actual day? And I say that from the perspective of when it's a sunny day and then you get your eye drops and you forget your sunglasses on that part of the side.
So I was going to say, make sure you bring your sunglasses or a cap, or, just something that's going to take the glare off. Make sure you don't drive to your appointment as well. That's really important. You shouldn't drive when you've got those drops in your eyes. So yeah, if you wear distance glasses, please bring those for when they do the vision check as well. Yeah, I think those are sort of sensible things to do.
Did you have another question, Josh?
Yeah, which, to be honest, Joe's put a message in the chat there about reversing treatments and sort of reversing when it comes to mentions of food. But I was going to put down the signs of how can you tell, are there any early warning signs when it comes to diabetes, eye complications, and how can we best, after having the feedback from our clinic, how can we best try to reduce the background, such as retinopathy?
So as Sam said, it's there are some things that you can change and some things you can't change, and it is very much about keeping everything on a nice even keel, looking after yourselves, making sure you attend your appointments, because as we've said in both talks, you might not know that you've got those changes there, and that's why we're the early warning system. One thing to say as well is that if there are a couple of reasons why your vision could feel blurry. One could be because you've got that, retinopathy or maculopathy, which is affecting your vision. But also, if your sugar levels have been running very, very high at some point, that can make your vision feel blurry as well. But that will come and go, and that's because when the sugar causes the lens in your eye to swell, and that's what gives you blurry vision, but that's at the front of the eye, not the back of the eye where the retinopathy would be. So yeah, there's sort of two. Have I answered the question there? Sorry, I feel like I've gone off on a tangent.
Yeah, I think so. So yeah, no, Holly's asked, with the right treatment, can it go away?
That's probably a question for Sam, because I'm one of the screeners and one of the graders. I'm not the clinician that treats people. So it can, with the right treatment, it can prevent it from getting worse. But it also, if you have something like maculopathy, it can restore some vision as well. So I don't think you can say it could completely go away. You could still have some background retinopathy, but it's yeah, that's not an easy question to answer because everybody's different and every case is different.
Yeah, I think go away and speak to your team about that, really, is our best advice for that. Another question I've got here for the young leaders. So you all spoke about your experiences and they were all great and quite positive, but I was wondering, is there anything you wish your eye care team would do differently, and anything they could do to support you more? Feel free to jump in, whoever wants to answer that.
I think for me, when I moved away from home, I had to move like my doctors and hospital care. So similar to what I was saying before, that this year was the first time I'd been to the health centre, and also last year was the first time I went to a different one. So yeah, just having like an adjustment or like a transitional thing. It's quite daunting going on my own for the first time. I've always had like my mum or my family support me and be there. So yeah, I think that's just one thing that I suggest.
Perfect, thank you. Any other young leaders got any more insight into that? Nope. Fab. Josh, do you want to go for the next bit?
Sure. I've just seen it also with that last one there. When it comes to Joe's comments, so this probably directed you at yourself, Charlotte. Mentioned about the background again, evidence and such. Is there any like foods or diets that can sort of help with the process, or is it something else that you'd encourage more with?
Again, that's not really my area of expertise. I'm an expert of looking at the pictures themselves. So I think that would be a question for your diabetes doctor or your dietitian, your diabetes dietitian. But I can certainly, we can take that back as a question to Sam and see what she says, and we can let you know if that's okay. But as I also said, you know, sometimes when you've had diabetes for a length of time, you know, we do see, you know, younger people who do have these little dots and spots, but they can come and go. You know, that's not unusual. And a lot of people think, oh, well, the test I had last time must be wrong because now I haven't got anything. But actually, it can come and go. So just to let you know that, because we do get a lot of questions about that.
I can attest to that one with my screenings when I've had them. Worried one time, and the next time the clinic say it's okay. So thank you very much. Rosie, any questions from yourself? Or I feel like everyone's all questioned out on the panel.
No, I think that's all I've got personally. And there doesn't seem to be any more in the chat.
Oh.
So now is your chance, everyone. If you want to ask any questions, please do ask them now. Young leaders, do you have any questions you'd like to maybe ask Charlotte or ask each other? No questions. Josh, I think we've run out of questions here.
Never happened before. Never, ever. But we want to thank every one of the panelists on the call this evening. So Charlotte, Megan, Gareth and Freya, thank you. Oh, I'll answer this one. We've got one question at the bottom. How many years after onset of type 1 does eye changes start? Which is actually a really good question.
It is a really good question, but again, it's one that's very difficult to answer because everybody is different. I mean, usually we'd say after 8 to 10 years duration of diabetes, you would expect to see some of these background changes. But then the other thing is we don't always know how long people have had diabetes for before they were diagnosed. So it's very hard to say after this amount of time you will see this, because it's unfortunately it's a bit of a how long is a piece of string question, if that makes sense, because everybody's case is slightly different. But if you have any concerns, ring your programme. They'll be happy to talk to you.
Thank you, Jane, for the question. And again, thank you to our panelists for all the helpful tips. And something that I have realised as well, when it pops up in a moment, there'll be a poll at the very end just to go over all the stuff that we've spoken about. But Together Type 1, some of you might be new to this, and Together Type 1 is a youth programme that is across the whole of the, I was about to say the North of England, that's because it's my patch, across the UK, and we cover people between the ages of 11 to 25. Please have a scan of this QR code on the screen. It will have all the information that you have, and you'll be able to speak to members of the young panel because they attend face-to-face events, online events such as this. You'll get to speak to people such as Rosie and myself, and also Charlotte, who is able to do big events, as you've seen already, and able to speak about all the questions that we all have when it comes to our type 1 diabetes. But what I will leave you with right now is our poll.
There we go. It should have popped up on your screen. Just give an answer if you can, and then I think we're gonna wrap up there, aren't we, Josh? Bit about 10 more seconds. Everyone should have clicked it by then. And there we go. Perfect. Thank you, everyone. Josh, don't know if you want to close this off for us.
Again, I'm going to keep repeating, but thank you all for attending. Thank you to the panelists, and most importantly, have a very lovely evening. We'll be having this video recorded, so it should go out in the future. So if you want to have a little look again, it'll be there to see. But please feel free to look up Together Type 1 and be joining in any future events with ourselves. But most importantly, have a lovely evening. Bye, guys.
Thanks, everyone.